As Congressman Bacon, you have been working on a bipartisan health care plan. Of course, the battle over these Obamacare subsidies is still very much on. The president last week seemed open to an extension and working with Democrats on health care. Listen.
I'd rather not. Somebody said I want to extend it for 2 years. I don't want to extend it for 2 years. I'd rather not extend them at all.
Will you do it?
It may be some kind of an extension may be necessary to get something else done, because the Unaffordable Care Act has been a disaster. The premiums are going up, and it's the Democrats' fault. But, you know, they are negotiating with me. It's very interesting.
So there's been pushback from Republicans on the Hill. Congressman Bacon, where does this all stand right now? There's a lot of talk, a lot of headlines flying around.
I belong to the Main Street Caucus, also the Republican Governance Caucus. Problem solvers, I'm part of that too. I would say 90% of us in these caucuses, you're talking about 100 people, we feel like we need an interim extension, a short-term extension. I think 2 years is appropriate, frankly. And we need to make some changes to those credits. Right now, you can earn up to $600,000 and get these tax credits. About a third of the money doesn't go towards lowering individuals' premiums that we've been doing over the last few years. We'd like to make sure every dollar that's spent is lowering someone's premium.
But you are open to
yes,
extensions.
I'm the author of some of these frameworks on there, and I'm working with Democrats across the aisle to do that. But most of us think we need a short-term extension, and give us time to work on something more meaningful and deeper. But you're not going to do something significant before December 31st. And if we do nothing, people's premiums are going to go up significantly, and we don't want to do that.
Congressman Khanna, where are Democrats on this?
Well, first, we need national health insurance. The private insurance market is broken. But before we can get to Medicare for all, before we can get to a real solution, we need to make sure that people aren't being hurt. I was talking to a son of a taxi driver who has cancer in Arizona. His father's insurance is going to go up from $44 to $2,600, partly because of making a little more money, but partly because the credits aren't going to be extended. That is absurd. So while I am a supporter of Medicare for all, while I think private insurance companies are ripping off the American people, I am open to a compromise to get those tax credits extended. I wanted them permanent, but you don't get exactly what you want in Congress. And so I believe Representative Bacon's made a good faith effort. If we can get 2 years, if we have to have certain compromises on at least covering people up to $200,000.
So you would sign on to Representative Bacon's plan?
Well, I haven't seen the details, but I'm open to it. I mean, it's not exactly what I want. I'm sure it's not exactly what he wants. But in Congress, you know, there are 435 of us. You got to have some compromise.
So you've been working on this. Why do you think leadership has been so resistant?
So if I may, we do have some Democrats already on this framework. Tom Suozzi, Josh Gottheimer. We have some Republicans on there as well, and some from some pretty red districts. Now, the pushback that we get on our side is these tax credits don't solve the problem. I mean, the costs are exploding. Obamacare or ACA is becoming more and more unaffordable. It takes more and more tax money to make it affordable. And so they're saying you're just extending the problem, you're not fixing the problem. And there's truth to that. The problem is it's our constituents who are paying for it, and we're not going to fix this before December 31st. And I'm more worried about our constituents seeing $1,000, $2,000 increases in their monthly premiums, right? So
and politically, I mean, if people are feeling that in a midterm year,
right? So it would be political malfeasance to not extend these to some degree. Yes, with some reforms, but to do nothing would be.
Do you think
dumb.
Speaker Johnson is?
Well, I think he's got that message. We've told him this weekend that doing nothing's not an answer. And I get it. It doesn't solve the problem, but it does help our constituents. And let's get some time and work on this and do something
Have
more
you gotten
meaningful.
any indication from the White House about their feelings on your proposal?
Well, initially, they came out in support of our plan, and then leadership from the Congress called us and said, hey, we don't have enough support back here. So that's when he withdrew back. But the fact that he initially said that he would want an extension with some guardrails and compromises, to me that was promising.
So there's hope.
Yes.